Namaskar. Welcome to Tulip Mediworld Super Speciality Hospital. It's a 200 plus bedded tertiary care hospital aiming to bring world class healthcare facilities to Assam and Northeast. Today, we are talking about a special topic that often overlooked: adult vaccination. Most of us associates vaccine with childhood, but immunization continues to play a vital role in protecting adult from serious illnesses and preventable diseases as well. To help us understand why adult vaccination matters, we have joined here with a special guest, Dr. Kishore K. Talukdar, consultant in internal medicine, diabetology, and critical care at Tulip Mediworld Super Speciality Hospital. A warm welcome to our show, Dr. Kishore.
Thank you, Supriya, for calling me to this web podcast on adult vaccination.
Thank you so much. Thank you. So, doctor, let us begin with few important topic which often patients they were asking. So, on behalf of our guest and patients, we would like to ask you a few questions.
Sure.
Let's begin with very important question, like why adult vaccination is important, especially when many people believe vaccines are only made for children.
Yeah, adult vaccination is really very important. Many people believe vaccines are only for children, but that is not true. As we age, our immunity can weaken and we become more vulnerable to infections like flu, pneumonia, and shingles. So, adult vaccination helps us to protect from those diseases, keeping our loved ones safe, especially babies and the elderly, and reduces the spread of disease in the community.
Right. So that brings us to the next question. What are the most essential vaccines every adult should consider today?
Okay. So recently, the Association of Physicians of India, last year, most probably in 2024, has published adult vaccination schedule.
Okay.
And according to that, the most essential vaccines are influenza vaccine, which has to be taken annually for everyone, especially healthcare workers and those with chronic conditions. Then secondly, pneumococcal vaccine, which is very critical for older adults and those with weakened immunity. Then thirdly, hepatitis B. It is strongly advised for adults with special focus on high-risk groups. Secondly, shingles vaccine for herpes zoster, that is recommended particularly for the older adults. And nowadays, as you can, 2-3 years back, we had the biggest pandemic like COVID-19. So now COVID-19 booster has also been endorsed as an important adult vaccination. And lastly, tetanus, diphtheria, pertussis vaccine. So for adults, a booster has to be taken every 10 years. Now, Tdap, that is for adults, it has to be taken every 10 years. But for pregnant females, it is specially given routinely.
Okay.
I think these are the few vaccines which are very important.
It is really very overwhelming for us. A lot of information actually.
Okay.
So I'm sure patient when come to a hospital, they will be guided with a vaccine schedule, right, for the adults,
Sure.
like the way we give for children.
In my opinion, like there is a pediatric immunization room. I think every hospital should have an adult immunization room also.
Right. That's very, very interesting. Are there specific vaccines for adults living with conditions like asthma, chronic heart disease, and most importantly, like diabetic patients? How would you consider?
Yeah, adults with chronic conditions such as diabetes, asthma, heart diseases, like you mentioned, should always are always considered as high risk patients, and these vaccines are strongly recommended in those type of patients, especially the vaccines that I mentioned in the previous question of yours.
Right. Okay. So you recommend that these are the patients?
Yes, very
should
much.
be- Okay. So can adult vaccine also help reduce hospital admissions and complications? Because many people, we see that they are very scared to take vaccines, especially when they're a little senior.
Yes, adult vaccines can significantly reduce hospital admissions and complications. For example, as you see, many people take flu vaccine annually. Now, flu vaccine lowers the risk of flu-related hospitalization by up to 60%, especially in older adults and those with chronic illnesses. Then pneumococcal vaccine prevents pneumonia and bloodstream infections. So ultimately reducing the ICU stays and deaths in elderly or diabetic patients. And again, as you know, COVID-19 vaccine have also shown a marked drop in the severe disease and ventilator use few years back. Then again, hepatitis vaccine protects diabetes and chronic liver complications and hospitalizations. Then shingle vaccine prevents painful outbreaks and post-herpetic neuralgia, reducing the need for hospital-based pain management. So overall, vaccines reduce disease severity, prevent complications, and ease the burden on healthcare systems.
Which is very true, because as we see the healthcare industry, the number of beds and the population size, if we want to balance this, I think this is very important that we can avoid hospitalization, even complications. Wonderful, doctor. Thank you so much for this eye-opening insights. Lastly, now here is a very common belief we often hear, even our parents also. They always say that, I'm healthy and I don't need vaccines. What would you say to that?
Yeah, that is a very common belief. But even healthy adults can get sick. So you can tell your parents also that even healthy adults can get sick, and sometimes more seriously than expected. Vaccines are not just about protecting yourself today. They are about preventing future illness, reducing complications, and helping protect your community through herd immunity. So staying vaccinated means you are not only shielding yourself, but also those around you who may be more vulnerable to those diseases. So on conclusion, I will tell that vaccines are not just for protection. They are an investment in your health, your family's safety, and your future. So you should talk to your doctor as soon as possible for adult vaccination. Adult immunization.
Right. That's a great note to end on. Before we wrap, doctor, a final takeaway for our viewers.
Sure. So I will just say that like pediatric population requires vaccinations, regular vaccination, routine vaccinations. So likewise, at least adult peoples, especially the elderly peoples or the peoples with some comorbidities like diabetes, hypertension, or chronic kidney disease are strongly recommended to go for adult vaccination.
Right. I'm sure like those patients, those who are going to dialysis and other, they are also should consider this.
They are to routinely recommended for vaccines. Even those are not on dialysis, even the patients who are frequently having flu illnesses, that is very common.
Right.
So those people, every people should at least take the flu vaccine annually. Then pneumococcal vaccine, especially the people with diabetes and hypertension. Then in elderly people, the shingles vaccine. Then routine immunization with hepatitis B if they have not taken in childhood. So, and even the now tetanus, diphtheria, and acellular pertussis vaccine, these are routinely given in pregnant patients.
Okay.
So at least the adult should at least take the booster dose every 10 years.
Okay. That's really very wonderful and very eye-opening. Thank you so much for giving this insight.
Thank you. My pleasure.
Thanks for being here with us.
Thank you. Always.
It's really a wonderful session where we have learned how adult vaccination plays a major role in our life. And please dedicate to your family members, your loved ones, a gift of adult immunization. We can save our family and friends. So thank you so much for watching this show. And we wish you a healthy and happy life ahead. Please visit our website, tulipmediworldhospital.in. Thank you so much once again for watching this show.
Thank you.
Namaste.